Welcome anybody that's new. This is our third session of motivational interviewing with Dr. Ivory Tubbs. Next slide. Just a reminder that this EHCO session is hosted by Southern Utah University Center for Rural Health. We will be recording these sessions. The slides and recordings will be available and emailed out to those that are registered. And then please feel free to share the registration and information in the sessions. We will be monitoring the chat and helping facilitate questions, so please don't hesitate. We'll look at the chat, the Q&A, raise your hand. If you have any questions anytime, then we will be having a little bit more interactive today. So hopefully it'll be enjoyable. Next session or next slide. Okay, so I'm about to turn the time over to Dr. Ivory Tubbs. He is a technical expert lead with WICHE, the Western Interstate Commission for Higher Education. Dr. Tubbs provides technical support to the Health Resources and Services Administration's Rural Communities Opioid Response Program. His expertise extends to multi-sector consortiums in rural communities, assisting grantees in planning and implementing their work plans to address SUD and OUD. So it is my pleasure to turn the time over to Dr. Tubbs.
Thank you kindly. Thank everybody for joining. Just want to jump into this week. Excuse me. I do no words. I'm just trying to get my tongue out of the way. Just to recap from session one, we don't have to go through all of this all over again, but again, we're looking at engaging the patient or your clients, seeking to make a partnership because that is key. Just like within the medical community, when the physician and the patient are on the same page, that's when the healing can really start. And then, work to understand the patient's influences. What are the things that influence their behaviors? Why are they where they are right now? And then assist them in identifying those behaviors and what affects their goal making. And then you want to aid them in really working through just that ambivalence, working through why it is that they do or don't want to change or do or don't see that there's an issue that needs to be addressed. Session 4, we talked about the key processes for motivational interviewing: engaging, focusing, evoking, planning. And with the engaging part, that is where we discussed about you as the clinician, as the interviewer, how you engage the patient or the client is key to how far you go, how far you get. Sometimes that engagement can be over multiple visits without a lot of conversation taking place. But it is always a good idea to make sure that you are engaging whoever it is that crosses your path in your facility, even outside of your facility, to make sure that you're engaging these people so that they will know that it is okay, that you are a safe person to talk to. And then again, focusing. Let's focus on the issue. What is the real issue? And then evoking, having them explain to you that they understand where the problems are, that they want to possibly make a change. That doesn't mean that they always want to make a change just because they do. You evoke them into thinking about why they are where they are. But it is an opportunity for self-reflection for the patient or the client. And then once you get to the point where they do want to make a change, then, excuse me, that's when we engage into the planning phase. How we're going to do this? How are we going to get you to where you would like to be? So with the stigma survey, we talked about the survey last month. We guess, in the chat, can people let me know what you thought about the survey if you took the survey? The survey was to address, or really just to self-reflect to see what you thought about stigma. Where were you with stigma? Some of the questions that were in that survey were pretty strong questions that I may not have ever asked myself. But sometimes with us being in the field, we don't always think about where we are with stigma and SUD. So it's always a good idea to take a step back and to just, see where you are, realign yourself to your goals. And sometimes we do become a little tough-shelled when we see as much as we see in the community. Sometimes, we see the human condition at its worst, and kind of toughen you up a little bit. And sometimes it can cause us to be less um, empathetic to people than we probably should be. Um, is there anything in the chat, Franca? Um, Anybody who was taking it? Any feedback from them? And you can also please speak up. This is not me talking at you. If you are welcome to speak up, you're welcome to share some of the things that you've taken away from that survey.
I don't see anything in the chat yet.
Okay.
However, I did the survey myself, and even though I work with grants that help reduce substance use disorder and provide all these amazing resources, I was surprised that it still said I had I think it said light to medium bias.
Mm-hmm.
And I thought I was doing really well. And I was like, oh, I guess there's some stuff I should be working on still.
No, thank you for sharing that. And that was the purpose of the survey. The survey was really, again, just a self-reflection to see where you were or see where you are on the topic. A lot of times we see things from the perspective of, well, no, I don't have a problem with that. Well, have you been in a situation where you had to work with someone who was struggling with substance use disorder? How would you feel? One of the questions that kind of jumped out at me and the one of the creators was, if they're if one of their children was planning on marrying somebody with a history of substance use disorder, how would they feel about it? We Those are questions that you may not always ask yourself. So I wanted to put that out there first, just so that everybody can kind of just take a moment to reflect back on, what do you think? Because a lot of times that will dictate how you interview, or if you even care to engage in motivational interviewing with someone. So this is the first example, and I really want you to listen very, very close to the non-verbal conversation that is taking place.
I understand that your asthma symptoms have been just really out of control. So we need to look at some of the ways that you can get healthy and not be back here again.
Yeah, I definitely don't want to come back here. But the doc said, Oscar, my dog, is connected to my asthma symptoms. But the ridiculous part is I've had him for 12 years before, and now it's a problem.
Well, you sound a bit surprised by that, but I'm sure that you've seen some of the material that the clinic gave you about asthma symptoms and managing your asthma, and pets are a really big source of problems in that respect.
Yeah, let me just clarify. I've seen the materials. I have them. I haven't read them. All I've been doing is taking the medicine, so I don't know that much about this.
Well, wait a second, Sal. What do you mean if you, as a, to be informed about? I'm just really taken aback by that, because I understand from your chart that you have a young baby, a new baby.
John Carlos, yeah.
And you are very concerned about your health. You want to be there for your baby, and that you've already taken some steps. You've almost quit smoking, which is fantastic. So the next step is to really deal with the dog, deal with the pet. I know it's going to be hard to do that, but there are always people who will adopt animals. I'm sure that you have friends or family members.
This is a little too much to wait now. First of all, John Carlo is taken care of. That's fine. He doesn't have no asthma from the dog. It's just me. I don't have.
It's you that I'm worried about, Sal. It's you that I'm worried about. Okay, the symptoms are worse. You've had 2 or 3 major asthma attacks, and do you appreciate how this is a risk to your life, that there are some adults with severe asthma who actually can die as a result of their symptoms? It truly is something to take very, very seriously. I can't emphasize that enough.
So Oscar's gonna make me die. He hasn't made me die in 12 years. And the doctor's saying, oh, I don't know if it's the stress, the finances, the drinking. So what are we doing saying Oscar could make me die? I've had him for 12 years.
Sal, what, do you understand that what happened 6 years ago or 10 years ago, your asthma is progressively getting worse. You know very well that the puffers, the strength of the medication is getting higher and higher. And there's only so much that can be done with medication alone. You know this.
Well, they can keep giving me more medicine and give me the strongest one, and I'll keep Oscar.
Sal, you're almost on the strongest one. And if Oscar's that important to you, then do you put Oscar higher than your baby, than your wife? Like, that makes no sense to me. Do you understand how important this is?
I understand that I don't think you get my situation. I've had this dog for 12 years. So I'm not just gonna up and get him out of my house when I don't even know if that's the main thing.
Okay.
Okay. All right. That was interesting. Let me get this thing out of here. Where are we going? I apologize, y'all. I don't know why this won't let me advance. Hang on just a second. All right. My apologies. So, how much was wrong with that? Now, I'm not even going to say what was wrong. How much was wrong with that? Did you notice how the client was really, he started to become very guarded, very defensive? That's one of the first questions. You know, was the interview engaging at all? Was she anywhere near engaging?
No, she was almost arguing with him.
Exactly. That's what I was looking for. She was very confrontational. And
Chapel said in the chat he was not even able to talk much. She kept
thank
kind of like
you.
cutting him off.
That's there you go, right there, right there. And when you have somebody, and I said this in the second session, when you have somebody who is coming in to your facility, that is an unknown place for them. That's a scary place for them. Some people have white coat syndrome. And for people who don't know what white coat syndrome is, when people go to the doctor, they go to the hospital and their blood pressure is fine or what have you. And then the minute they see the doctor and they know that they're in the doctor's office, they get their blood pressure taken, the blood pressure spikes. This is unfamiliar territory. So you're exactly right. It did not give him a chance to talk. Did not whatsoever. So about focusing, what was the interviewer's focus? What do you think that the interviewer was primarily focused on?
Blaming the client was put in the chat by Chapel.
Exactly. And this is where we talked about in the first session. This is where you've got to fight that writing reflex. I want to tell somebody everything that they're doing wrong.
Yeah, Amanda said lecturing the client to make better choices.
Yeah. Tell me how that works for anybody
It doesn't work.
at all for anybody.
Well, he even said like you're not understanding me.
Right. Right. And if you think back to his body language, his hands were clasped, right? His hands were clasped. He was trying to figure out what he needed to do with himself. You could tell he was visibly irritated, but I commend him, and I know this is just this is an example, but I commend him for managing himself, because there are some people, and I've seen it, they would not have that amount of self-control. I promise you, especially
Well,
when you start attacking.
to say
Right?
she was getting more rapid fire. She was getting louder.
Mhm.
Her language was getting stronger, and he stayed calm. He was the one staying calm, where it should be vice versa.
Exactly, exactly. You could see on the interviewer's face, she started to become exasperated. What do you mean? What do you mean? What I mean? If he said he has not studied the literature about the medication, he has not studied it. What do you mean? What do you mean? There's nothing else there, right? She kept pushing him.
Chapel said her tone of voice was angry and frustrated. Agreed. And it just kept
Absolutely.
getting worse. Like, I'm like, where are we going with this?
It did. It did. It and then you remember one point in the video, he was like, okay, wait, just okay, wait. I mean, it's sad, and this is what you never, ever, ever want to happen. You never want your patient or your client to ever have to take control of the interview. Because once they take control, I can guarantee that your authority will be questioned thereafter. Do not put yourself in a position to where they have to take control. You are the one who is supposed to make them feel welcome, make them feel comforted, allow them to talk. You remember when we talked some time ago when I said that last week, when I said that my patients want to come in dressed like Big Bird, fine. If that's what works for you, fine. That's not my job to ask them why in the middle of the summer you walk around with a Big Bird costume on. I can get into all the reasons why. First of all, you look crazy. Secondly, it's hot. Third, you're gonna pass out from heat. I mean, we can get in all that, but what did that do? That just puts somebody on a defense. And then when you started talking about the evoking, was a client interested in making a change in any way whatsoever? Mm-mm, it wasn't. What I saw, and please share, and then there's no right or wrong answer. What I saw was someone who was focused on getting her to shut up. As raw as that sounds, he was trying to get her to shut up because what was she doing? She was attacking the things that he cared about. There's no way, there's absolutely no way you can get somebody on your side by attacking the things that they care about. I don't care how great a working relationship you have with somebody. I mean, it's like you meet their kids, you're like, man, the kid is funny looking. Do you How do you think that working relationship is about to go? You call somebody's child funny looking. It's the same thing. When you attack what people care about, they tend to care less about what you care about. And
Chapel,
then
com Chapel commented, he is just going to leave and do nothing different.
nothing, nothing at all. There was nothing in that conversation to motivate him to do anything any different. And honestly, as long as I've been doing this, there's some people, and I've said this before, there's some people who are some therapists out there that I've worked with who are just, I mean, they are walking train wrecks. And when I would see when I would see patients going in, you kind of want to like, hey, don't go, don't do it, don't do it. I knew, but that's what happens.
Well, it was kind of frustrating to watch because he was trying to even come up with like, are there other options? And she was just shutting it down and saying, this is the only way. This is the only
Yeah,
thing you can do. There's nothing else.
exactly. And that's why I said when your patient takes control of the interview, you've lost. Game over. You have lost. Now, maybe somebody else might be able to have some success with that patient, but if they got to take control of the meeting, nope. Because think about it. Even in life, if there's a situation where you are supposed to be a guest, and I'm sure this has probably happened to all of us, we've been invited somewhere and you get there, and then all of a sudden you get put to work. You're not that interested in being there anymore. Right. So we get to the planning part. What plans what plans did the client make during this whole time, other than planning his escape? I mean, I'm sitting here watching them like, yeah, we're not doing this. Uh-uh. So I want you to see this one. This is, and that was the first one was clearly what not to do. This is what it should look like.
And that.
Hang on, let me back it up. Go for it.
So when you said you'd like to start, Sal, is talking about your asthma and specifically about your dog and how one is affecting the other.
Yeah, my asthma's just been out of control lately, and my doctor says it might be connected to Oscar.
Hmm. So what can you let me know, or what do you know about your asthma and the things that affect it or might make it worse?
I've got allergy testing. It's just the dust makes it bad. I thought the smoking was another thing that's cut down. And then they said the drinking might contribute to it too. So I got a lot of different things I'm working on. So that's what I know. The drinking, the smoking, and the dust that I got the scratch test for.
Right?
And that's what I know, and that I take the medicine for it.
Okay. And that your pet has never been mentioned as a concern.
No, I've had it for 12 years, and now it's a concern. I don't understand.
Yeah, and I can see that you've already worked hard to make some changes. You've almost quit smoking. You're just down to your last couple of cigarettes, and you're not even smoking those in the house. Your house is totally smoke-free.
It's that way.
Yeah, okay. And you have also thought about cutting back on alcohol, and I think you mentioned done a little bit towards that.
I'm a couple down. I used to drink 4 a night. Now I'm down to 3.
Okay. So now, almost like that's not good enough. Like now you have to, now the dog, and now what's
What's
next?
next? Yeah,
Right,
yeah.
okay. So, I mean, there is certainly a lot of evidence that pets in the home and the dander from their fur can make asthma worse. But I wonder what are your experiences with Oscar, you know, when he's in the house or maybe sleeping near you or you're around him, what happens with your asthma symptoms?
Well, we keep him clean. Like, he's clean. So all the dander doesn't really make sense, but I have been noticing that sometimes when he comes on the bed or just beside, I wheeze a little bit, but I think it has to do with the hair, in my lungs cleaning itself up from the smoking. So I don't know if it's that's why I'm confused. I don't know how this could be happening.
So it doesn't make total sense to you that it's all Oscar's fault and that that's the only solution.
But the wheezing is something that I definitely noticed a little bit.
I guess I also wonder whether, regardless of if your asthma symptoms are connected to Oscar, that maybe part of you feels like it's worth it because he's been such a big part of your life for so long.
I just want some medicine, and I want to keep Oscar, and I want to feel better about myself because I'm making all these changes in my life, and it honestly feels like my nose is just above the water.
Yeah, and in the end, you know, whatever you do about Oscar, about your asthma, about all the other things that we talked about on that agenda setting worksheet, I mean, you are in the driver's seat, Sal. It really is your choice.
Yeah, no, that feels good that at least it is my choice. I just feel like I'm not feeling happy about just all these different things that are coming up. And I'm kind of sad about things. And I don't know what to do.
There's a lot of decisions and a lot of change with your wife, with the new baby. And now thinking about looking after your health and wanting to be healthy for your wife and your baby.
I want Giancarlo to grow up with Oscar, so he has his friend when he's young too. And it's a lot of stress and a lot of things you got to think about, and I'm not feeling good about it.
So what would need to happen, or how would you know when or if you ever did have to make a decision about whether to keep Oscar with you or not?
And how would I know? I don't know. I think if my asthma got really bad and the medicine, if she gave me the strongest medicine and it wasn't working, that would be the way right now, because I don't know how I'm going to give this dog up.
Yeah. And I get the feeling that it's something that you want to think about, that this is a really big decision and it's not one that you're going to make in a hurry.
No. It's something I got to just sit there and kind of put the pros and the cons on the table about, but something.
Gotta do this again. Come on.
I just wanted to take a moment to let everybody know that if you unmute, you can respond verbally if you would like. If you have any problems with it, let us know.
Yeah, apologize for that, Joe. This thing is kind of goofy.
And that's
Right. In the world? I promise I'm computer literate.
what I know, and that I
Oh, fudge.
take the medicine.
In the world? Ah, okay. My apologies, everybody. So the example, number 2 example is something that I wanted to show you to compare and contrast, right? So when you look at this one, did the therapist engage? Did the interviewer engage? Did you see that a strong collaborative, excuse me, relationship was established? Could you see that in how she asked the questions, her body language, how patient she was to hear the answers? What about focusing? During the conversation, did you notice how there was truly a mutual understanding on what they needed to focus on? Remember, he mentioned the dog. She understood. She didn't try to make him feel guilty because he had the dog. She understood. "Hey, you know what? I can see that. That's kind of tough. I see that you want to keep him. I understand that. What else have you tried?" Even though he was drinking, he did mention the drinking, but they focused on what the client needed to focus on. And sometimes when you're doing this, and this is just a side note, sometimes when you're focusing with the patient, sometimes you may focus on an ancillary issue, not the main issue all the time. Let it go there. Let it go there. Let them talk about what they're comfortable with talking about. Now, it'd be different if, you see someone come in and you know that they are noticeably under the influence of something. That's a different situation. But if there is, say, this substance use disorder, if they need to talk about how bad their allergies have gotten and their asthma because of their dog, let that happen. Because again, we discussed this some time ago. That first interview may not be the interview that goes very far towards helping them to understand that there's a change that's needed.
Well, I think it was a total change from the first time around because she stopped talking so much
Right.
and listened and then was reflecting what he was saying
That part.
to make sure she could understand. So that led to lots more information than you have to get rid of the dog.
Exactly. And did you noticed in that video what happened? Um, the questions that she asked were, and we'll show this later, the questions that she asked were really succinct, just kind of to the point. Did not give him multiple things to answer at one time. It kept them simple, not to insult his intelligence. But again, remember, this is not their environment. This is our environment. We're used to this. So we have to put them at ease. Then you start talking about evoking. Um, did anybody hear or not hear the interviewer expanding on what the client was saying that they needed to change or thought about changing?
I thought it was interesting how she was kind of anticipating
Mm-hmm.
how he might be feeling, like, maybe you think it's worth it to have the dog, kind of giving him a way to think about his reluctance.
Mm-hmm. And I like that. Sometimes and this is just my mental picture. Sometimes I think about a shortstop in baseball or softball. When the ball is hit to you, you've got to be ready. You don't know if it's going to hop. You don't know if it's going to be a line drive. You don't know what it's going to be. And I think in this example, the interviewer did a great job of just being ready to anticipate where he was going, and not push. She didn't push him at all. If you notice that, she just simply said, "Okay, well, I can understand you've had him for a long time. I get that. What else have you thought about?" she mentioned and this is what I do like. She did mention something about, look, sometimes, pet dander is, one of the main catalysts for people who are struggling with asthma. She mentioned it, but she didn't camp out there. That's one of the things that I love. I noticed in that she did not camp out there. Look, hey, might be a problem. Like it's like if telling somebody, look, drinking or driving under the influence might not be a good thing for you right now. It may not be a good thing because you put other people in danger, and leave it there. Take off. What were you gonna say, Chris?
Was it Leah was making? Oh yeah, Leah, did you want to talk?
Yeah, I was
Okay.
gonna say, I noticed that she was actively listening, like making sure she was repeating back his statements, so like she wasn't off in space somewhere, and actively participating in the conversation. And then I also noticed that no one person took over the conversation. It was a genuine dialogue.
There you go. Thank you. Very, very good point. And that's one of the reasons why I took I got the image that I did put in here now, because they've come together. They're doing this together. You got to remember, when you're doing MI, this is a team sport. I don't, no one walks away, the interviewer walking away with your head held high. And the patient or the client has not progressed is a loss. You remember earlier, we talked about this goes how you want this to go. This can go as fast or as slow as you want this to go. This is not about my recovery, or this is not about my making a change. This is about you making a change. So excellent point, Leah. Planning was, what do you think was explored during that conversation about planning to change?
Well, I think the client was actually able to talk about all of their concerns. So then you could pick which ones to needed to be maybe addressed first, or how to work all of them in.
Exactly. Exactly. And if you think back, the interviewer offered some ideas. Well, have you looked at this? Have you looked at that? Now, that's kind of priming the pump, because the client could have easily said, nah, I don't want any, I want none of it. But remember, this is our environment. They may not always think on their toes. Now, there are times where, I've had to speak or something like that. And man, I had a good thought, in the moment, poof, gone. Same thing with them. It's okay to offer suggestions. It's okay to help them. If say they're trying to complete their sentences and they're not quite getting it out, that's when you're asking, can I help? Why is that a part of planning? Because what you're showing them is that, look, I am not rushing you. If these are some ideas that we can engage in to help you get to where you want to be.
Chapel made the comment, she really helped him think about what the situation would need to look like before he was willing to consider maybe getting rid of the dog.
Absolutely. Absolutely. Remember in the first example, she was like, you got to get rid of that dog. Shut down immediately. But to your point, she did. She offered solutions. What do you think? What about this? What about that? I can see that you've had a dog a long time. And the other part that I really liked about that was that she listened to him. Again, like you were saying earlier, Chapel, she listened, actively listening. I've had this dog for 12 years. No, I'm not gonna say that because it's recorded. You'd have to be extremely special for somebody to tell you that they've had a dog for 12 years, and in 12 years that dog has not caused them any medical problems, for you to say, hey, it's time for you to get rid of the dog. Come on, stop it. Thank you, everybody, for participating. All right, we're gonna do.
I was gonna say one more comment too on that was that she came across very empathetic to the situation, which I think helped him relax. He started leaning towards her more, like talking more. And I really think that was really shown where the empathy with active listening just really helped that conversation move
Absolutely.
along.
Absolutely. We've always got to pay attention to body language. We've got to pay attention to that because that is a whole different conversation. It's one of the things that I learned early in my probably 25, 26 years ago. I remember because I was working with kids. And I remember where we as adults, we don't always realize how imposing we seem to a child. So when you talk to a child, and I'll do this to this day to anybody, um, when you're talking to a child, you always stand askew. You always stand open so they don't feel like they're being blocked off if they feel like they need to leave. We all know that if you and somebody else are toe to toe and there's a tense situation, that's flight or fight, right? So it's the same situation with this interviewer. She understood. She was not literally, but figuratively standing askew, just kind of turning aside. Okay, well, what do you think? I think that's a great idea. I think this, I think that. Sounds like you this, sounds like you that. That's how you elicit more involvement from the client when we're talking about motivational interviewing and making a change.
Well, I'm just not sure that I'm ready to quit. I just don't think I can do this right now.
So you're really not confident that you'd be successful long term?
Yeah, pretty much.
You know, I know quitting is really hard. And it takes a lot of strength to go through that. But is it the hardest thing you've ever done?
Well, it must be because I haven't quit yet.
Well, in all seriousness, I know there's other hard things you've been through. So is quitting really the toughest thing you've ever done?
Oh, of course. I mean, going through my divorce was difficult.
Then you got through it.
Yeah, but that was just different circumstances.
It is a different type of difficulty. You're right. And I don't want to make light of that. But the point I'm trying to make with you is that it was difficult and you rose to the challenge and you got through it.
Yeah, that's true.
So what I know of you is that when you're faced with a tough challenge, like a divorce, you rise to the occasion and you manage to get through it and you come out on top. So are you ready for the challenge of quitting?
Yeah, I hear what you're saying, but I just don't want to be a failure. I don't want to let people down. I don't want to let my family down, and I just don't think I'm ready.
Well, I do totally respect your decision. If you really don't want to quit and you're not open to it, then that is your choice. Whatever you choose to do about your smoking habits really is your choice, and I do respect that. So where do we go from here?
Well, I don't want to quit right now, but I know that in the past, cutting down has helped me.
Cutting down, that would be a great step. I mean, that would be wonderful. So I know you've tried before. What else have you learned? What other lessons have you learned from quitting? I'm guessing you've learned a lot of lessons.
Well, I know in the past the nicotine gum has helped me. I just didn't really care for the taste.
Well, I have some ideas on that if you'd be open to hearing them.
Sure.
They've got a lot of new flavors on the gum. There's cinnamon and orange and juicy fruit, which is a popular one, and mint. And I've had a lot of people have favorable things to say about the new flavors.
That sounds good. I didn't know that.
So you think you might want to try the gum again in addition to cutting back?
How about if I cut back for a month and then I'll try the gum?
I think that is an excellent idea, and I think that you really will be able to do it this time.
I hope so.
All right, y'all, I'm doing this again. No, go away.
I just don't think I can do it.
Why did no one tell Oklahoma drivers?
Yeah,
that
pretty
was
much.
illegal?
Hey,
Because
we got a whole lot going on right now, y'all.
And if you have automatic headlights, you can be paying so much less than your car insurance. Even more than that, if you're a good driver and you haven't had a ticket in the last 3 years, you get a bigger discount than that. But do you think your insurance agency will tell you that?
No, all right. Man, all right. Don't critique me for my don't critique me for this, but let me just do it this way. So in this one, I like the fact that she did not I like the fact that she didn't push him. Do you see how they're sitting? They're just the way that they're sitting right now. You see how he's open. She's not pressing him. She's not in his face. She's giving him his air. She's doing what the best that she can do to make sure that he feels as though he is heard, making sure that he feels like he's a person. When you remember back to what he said, have you tried to stop? What's the hardest thing you've done? Is stopping that hard? And there was a moment of levity in there when he was like, I don't know, I haven't tried it. These are the types of things that you can do with your clients and your patients to be able to get them to open up to you, to let them know that, look, this is at your pace. Let me see, we'll do this. All
She
right.
she also recognized his comfort level when he wasn't comfortable with a big decision. She led him
Exactly.
forward into a smaller step, like how about gum?
Exactly. And that is, again, like we saw this last week. Just the good questions. They are short, they are succinct, they're to the point. They are giving him options. And you were exactly right, Leah. All she did was like, hey, I'll offer it to you. What do you think? Well, I'm not ready to quit yet. Okay, what was that? Resistance. That's fine. She didn't tell him how he needed to quit, how detrimental it was to him and his health and any of that. All she said was like, okay, well, what about the gum? Do you see how she was not deterred with his resistance and saying, I don't want to quit right now. And you know what? To be honest with you, that's something that I'd appreciate. I would appreciate someone just being honest. I had a lady some years ago, her husband and her daughter brought her in for an assessment. And um, and please pay attention to the last part. They brought her in for an assessment. That was already not going to go well, period. And it was for alcohol use disorder. And they were telling me everything that, this is happening, that's happening, and she's doing this and she's doing that, and yada, yada. And, to the lady's credit, I think that it was, the love she has for her family that brought her in. And so she comes in, and if she had defiant written from her head to her shoes, it was right there. She was like, look, I'm here because of them. But during that whole session, as we were talking, one of the things that I never did was I never pushed her. I let her have to make the decision. Let her and her family have to make the decision. And that's one of the things that I left them with. I said, well, look, um, this is something that you and your family are going to have to discuss. Now, we can help, I can help, but this is something that you're going to have to come to on your own, because as we alluded to earlier, nobody likes to be forced in anything. And anytime you force somebody into something, they'll comply to get you off their back. But it's never going to stick. And that's what we want here. When we start talking about motivational interviewing, we're talking about lasting change, incremental change. And one of the ways that we have to get that incremental change is being able to be empathetic to people, show them that we care, show them that with the evoking, show them that, look, this sounds like a great idea, but you came up with this idea. You decided this, and I want to help you. Remember before I was saying about priming the pump. I can toss out ideas and things that I think might work, but you know what? This is something that, if, like he said, the Sal with the asthma, and with this previous gentleman, I don't want to quit. Thought about gum. She didn't mention anything else about quit. That's an opportunity for him to say, you know what? Yeah, I decided to do the gum and maybe taper off. Do you notice? You see how subtle that was? Very subtle. What about the gum? I don't want to quit. Go ahead.
Keely made the comment, she did a great job at meeting him where he was at and validating his concerns.
Mm-hmm. Mm-hmm. We as human beings have an innate desire to want to be understood. Now, I don't care, you know, people are loners and all the rest of that kind of stuff, but we want to be understood. And when people aren't understood, a lot of times we become very defensive. And as you see, again, like with the questions, you know, just like the first one, I like that one because that's kind of what she did. She didn't say it, but she acted it. She acted on it. Took a bold step and wanted to talk today. Because a lot of people who are in the throes of substance misuse, be it nicotine, be it alcohol or what have you, a lot of times they don't want to talk about it because they are so used to people wanting to deter them from using it. And scientifically, we know abstinence models, yeah, they don't really work that well. So you can't always expect somebody to think that abstinence is the way, because you got to replace that. Unsolicited openings.
Watch what happens this time when the provider listens to what the patient is saying, empathizes with the situation, and attempts to work with the patient to find a solution that fits his needs.
Hi, can I help you?
Yeah, I hope so. My workplace has just gone smoke free. I'm not very happy about it. I'm gonna keep smoking, but I was wondering if there's anything that can help me like get through the day. So I can, you know, go get my beer and smoke cigarettes after work.
So your workplace is on smoke free, you're not too pleased, huh?
No, I'm not gonna quit smoking. I mean, I like it. It helps me relax. I mean, I don't see what the big deal is.
Okay. Tell me a little bit about how smoking fits in your day. It'll help with the.
I mean, I smoke a little less than a pack a day. It's not too bad. I've probably smoked for the last 5 years, but I mean, I could quit if I wanted to, but I don't really want to right now.
Okay, so you feel like right now smoking is a pretty important part of your life. It's not something you're ready to change, but if the time came when you did decide to quit, you feel pretty confident that you could go ahead and do that.
Sure, I could quit.
Okay, what makes you so confident?
Well, I mean, I don't see why I couldn't. Although I have not ever tried to quit. It's just something that I do for fun, you know, on breaks at work, in the morning and after work.
Mm-hmm. And so in terms of a readiness to actually go ahead and make a quit attempt, where do you think you fall on the scale of 1 to 10, where 1 is, I'm not considering it at all, and 10 is, I'm definitely ready, I want to quit?
I'm probably 2. I haven't even thought about quitting until this great announcement at work today. I'm totally not going to quit smoking.
Okay.
All right, y'all, I want to stop this real early because we are, I want to make sure that we have time, but I wanted to show you this because sometimes many of your interactions will be completely impromptu. And that's what I want you to be mindful of. Everything will not always be in a session. Everything will not always be by appointment. You saw this gentleman just walked up and he just started talking. You have to be, especially when you're at work, you have to be ready. You have to be ready for patients, clients to come up and want to just start talking to you, because this is extremely helpful to them because it is informal. They're not, okay, well, shit, I had an appointment. Oh, hey, I got to go up. They're going to ask me this. They're going to ask me that. This is where you have an opportunity to, again, you remember I said, sometimes sometimes the interactions, it may take a couple of times. It may take a couple of times for them to open up and then really want to talk about some changes. All right. Let's see, y'all. I'm gonna do this again. Dang it. Dang it. This thing is stuck. Anyway. Oh, okay. Won't budge now. I apologize, y'all. At any rate, I know we got about 9 minutes left. Be mindful that sometimes when we are, and I'm going to stop sharing because this thing, I don't know what's going on with it. One of the things that we ought to be mindful of when we're talking about motivational interviewing is the fact that there is, again, there's no prescription. There's no prescription for how we do it. There's no prescription for, okay, you come sit down and I introduce myself and I introduce yourself. You notice in this last one, that gentleman just came up and started talking. He just, hey, this is what's going on. I got this at work and I want to do something about it. What do you think? Those are the times where, as I alluded to, you know, a couple of weeks ago, a week, 2 ago, every day being an interview. You can have that conversation with that person, but there's probably somebody over in the corner who is watching you interact with that person. That might be a person who may pull you aside later. We always have to be mindful that we don't know where people are on their journey to wanting to make a change. So we have to also be mindful to not insult people, insult their intelligence, and try to be that subject matter expert at all times. If you notice with the pharmacist, yes, she had a white coat on. She was looking at charts. She's at work. Did you hear anything technical out of her mouth? You didn't hear anything. She just had a conversation. And that's what we have to always be ready to just have a simple conversation. And I will stop there and give people some time. Is there any questions or anything like that? And I apologize for the technical difficulties. I have used PowerPoint before, and I have used this computer before. You can't tell it today, but I have.
Really appreciated us being able to see like in action and see how it can work in multiple different scenarios. So thank you for walking us through those and letting us kind of dissect.
No, you're welcome. And I appreciate everybody for the input that you offered. And I can honestly tell you that all the input that was offered was spot on. The observations, being able to, like I said, dissect the fact that in the first one, you saw an aggressive, exasperated interviewer. Second one, you saw how the interviewer was empathetic and how that translated to the client being open, thinking about, you know what, maybe I haven't thought about it that way, because that's what we're supposed to be doing, right? We're supposed to spark thought for them to, again, during evoking, to make the decision, to feel like it's their decision that they've made to. In the last one, or second to the last one, the gentleman said, I don't want to quit. What about the gum? She offered the gum, but now it's his decision whether he chooses to chew the gum or not. So you see how that's empowering. So these examples were, sometimes they seem a little rudimentary, but at the same time, they're the basics. And it's just really an idea of what, how you can shape your methods.
Chapel commented in the chat, I really appreciate the perspective on these interviews not being structured or even always planned. That is something that has often intimidated me about MI.
Yeah. Sometimes, honestly, Chapel, you can, if you're talking to somebody, and again, this is you. This is how you function. If you notice that somebody in a situation, if you notice somebody's being a little nervous or something like that, or you're nervous, it's okay. Hey, come on, let's go take a walk. You know what? I don't feel like sitting in this office. You want to go sit outside? You can do that, depending on where you work and if they allow that. But you can do stuff like that. Hey, you know what? Let's go grab something to drink. What do you want? What are you drinking? You have that autonomy to be able to get the result, because that's the idea. You're working towards a goal. You're working towards a shared goal. You don't need to sit here and stare at me. We can go sit outside. We can go grab something to drink and sit and talk and what have you. Once you get good at it, you will begin to ask the questions that will give you all the information you need. You don't have to go, okay, now let's focus on evoking. I know what it is, and I would run away from you. The better you get, the more proficient you get at it, you'll be able to have those conversations with people, and they will have no clue that you're pulling that information out. And the beauty of it is when they don't have any clue, and then you flip it on them. You're just talking. You're like, so talk to me about that. Talk to me about those 6 beers last Thursday. What was going on with that? Wait, what? What did I just do? That was active listening. I didn't bring it up immediately. I let it come up naturally. And I caught you off guard. Not because I'm trying to catch you off guard, but when people realize that you're listening to them, they're more focused on what they're saying when they say it. You can extrapolate whatever information you need to extrapolate from those conversations if you keep it as informal as possible.
We have about 1 more minute for comments and then we need to wrap it up. If anyone else is thinking about something, just a reminder that we will be sending out the slides with all the information. We'll be sending out Dr. Tubbs' contact information too, if you have questions. Also, Franca's information's on there if you have any questions about getting the slides or information or the video links. We have one last session. We're skipping next week. And we'll be on, what is the date? I would think we had it on the slide.
15th. Hang on, you know what? I can do that part. I cannot screw that up today. You know.
October 15th, Tuesday, October 15th.
Yep.
At 11. Any last questions before we wrap it up?
No, thank you very much.
You're welcome. Thank y'all for joining. I know it's lunchtime, so hope you got a chance to eat, and thank you for participating. Really appreciate it.